Let's begin a three-part series on teeth whitening. So let's get into it and roll that intro. What's up, everyone? Dr. Eric Jackson here. Hope you're all doing well. Let's begin our three-part series today with kind of the basics of teeth whitening, right? First off, why might someone want their teeth whiter? Well, in general, and I don't think it's a terrible secret, modern society today views straight white teeth as desirable, right? We want to have, I want to also throw out there also, I try to really promote, people always say, I want my teeth to be straight and white. What you also want is you want your teeth to be healthy, straight, and white, and that is a much more comprehensive definition of what you should want as a patient and what we want as dental providers. A subtle little semantics, but a very important addition to that one word, healthy. Why might somebody have darker teeth, right? Well, there's a lot of reasons. Many articles, many papers have been written about this, so let's just touch on it briefly. There are multiple categories, some of which, what you eat and drink, natural aging, your age, how long your teeth have been, in function, for example, we'll call it the lack of dedication to good oral hygiene. If you have dirty teeth, if you have historically dirty teeth, and a dirty, poor dental hygiene, that can affect things. But ultimately, I think most people would agree with me. The number one reason that people notice it over time is a combination of time, but also mainly their diet, predominantly liquids, coffees, teas, things like that. Certain foods, of course, have a tendency to stain a little bit more. And then there's also the genetics involved with people's teeth. Some people have more porous enamel. It has a tendency to uptake stain, but also might uptake their whitening a little bit better. Other people have very dense enamel, and it has a little bit more resistance to whitening, but also resistance to stain. So, 6 of one, half a dozen of the other for those people. People often refer to whitening. Now, I don't like the phrase because it's inaccurate, but they refer to whitening as teeth bleaching or bleaching their teeth. There is no bleach in any whitening agent. Bleach is toxic. You can't just put a bleach gel in your mouth, let it dissolve in your mouth for a half hour or 7 hours or whatnot, swallow all that, and come out of that healthy. You will not. You will potentially die, and we don't want that. So what is teeth whitening? What's the major active ingredient in teeth whitening? Well, there's multiple different kinds, but they're usually a formulation that's either hydrogen peroxide or a close cousin to hydrogen peroxide. The number one cousin being carbamide peroxide. I'm sure by the time I even post this, there's more out there, who knows. But with that said, I always like to describe the hydrogen peroxide. It's not bleaching. It's not bleach. It's more like OxyClean. You're kind of, using the power of the hydrogen peroxide to penetrate into the stains and lift out the stains, much like you would in your laundry. Conceptually, this is more conceptual, of course, but I like that better because there is no toxic bleach in the gels that we recommend. So what general classifications are there as far as ways to bleach your teeth? Well, there's a lot of products out there. We'll get into that a little bit more in probably part 3 here, but let's touch on it just briefly. You've got your gels, you've got your toothpaste, and you've got your rinses. More and more products are coming out all the time, like I mentioned a short time ago. But with that said, those are the kinds that we talk about the most in my office. The gels we're going to spend heavily with in part 3, but essentially, in a nutshell, you've got your over-the-counter gels, you've got your take-home custom whitening trays from the dental professionals, and then you've got your in-office power, speed whitening inside the dental office. But in addition to that, there's a lot of over-the-counter options. You've got over-the-counter toothpaste, and you've got over-the-counter rinsing. Now, over-the-counter rinsing, I'm not going to spend a whole lot of time on in general, based on my patients that I've got in my practice here. They find the least desirable results from the rinsing agents. Perhaps it's not doing enough, is I guess what they're going to say, to meet their expectations. Expectations and responsibility are going to be our part 2. We're going to really focus on that a little bit in the realm of what the patients expect and what they're responsible, because this is a two-part street, or two-way street rather. So in general, they're not my favorite. They're my least favorite mode of whitening. Then you've got your toothpaste. Now, whitening toothpaste have been around for quite a while. Now, I'm not an expert in materials and proprietary information of these products and whatnot, but in general, it's a fair summary of the whitening toothpaste history, just to summarize them as saying, essentially, they're just extra abrasive in the past. Whitening toothpaste have been and still are very effective in that category of poor hygiene stain, poor hygiene darkening of teeth, because ultimately, if you've got a lot of extra debris, tartar, calculus, plaque, but also other items, patients who have certain dietary likes and they eat certain things have a tendency to really stain the teeth quite heavily. Pipe smoking. Pipe smoking is also a very important thing to talk about because it is introducing a kind of film, much like tobacco smoking, but more so with pipe. For some reason, the tobacco stain on a pipe smoker is much different than a cigarette smoker. These types of ailments, we'll call them, right, are actually solved pretty well by over-the-counter toothpaste, whitening toothpaste. Over-the-counter toothpaste that whitens, though, like I mentioned, it's extra coarse and rough historically. Now, some of that is changing. In the last couple of years, they've come out with less abrasive whitening toothpaste, less abrasive in the key is that I don't know if it's still minimally abrasive, or certainly not non-abrasive. All toothpaste is abrasive. But the big complaint with dental professionals about whitening toothpaste historically is that it was very hard on the teeth, it was very hard on the gums. It's basically like using extra coarse sandpaper on your teeth. Now, over time, and especially if you're not brushing your teeth correctly, if you're using too much force, if you're really scrubbing the dickens out of your teeth, and you add whitening toothpaste to that, you can really cause a lot of dental problems. Gum recession, erosion, attrition, all sorts of different things can happen from or directly, primary causation of this, or even in secondary causation. So historically, we've kind of shied away from recommending it because there's always the third option, the gel option, which is a non-abrasive, and I think the most effective way to whiten your teeth. So that's kind of the nuts and bolts of whitening. In part 2, we're going to talk about patient expectations, patient responsibility a little bit more. It's something I very much push as a conversation with anybody who's interested in whitening their teeth, because it is very, very important to have that talk. And then in part 3, we'll dissect the 3 major categories of the gel-based whitening: the over-the-counter, the custom whitening trays, or take-home, if you will, and then the in-office power whitening treatment options. Thanks so much for watching. I love these, short, brief, but also in-depth discussions. The 3-part series makes it, bite-sized pieces of a long discussion. As always, please comment below if you have any questions or concerns, if you have any ideas for future series or video topics. I'm always very appreciative for the great feedback we get from our viewership. And speaking of viewership, thank you so much for watching. If you would like the video, subscribe to the channel so you get constant updates. And when you do so, hit the bell. That way it'll pop up on your phone when a new video is uploaded. Until part 2, thanks so much for watching. I'll talk to you then. Bye now.